Handling minor injuries at home, a parent's first aid guide. Your child just fell and is bleeding. What is the first thing that you do? So in the first 30 seconds, your calm action could prevent panic and the infection. Are you ready? I'm Dr. Joshua Derito, a family physician. In this video, we are going to look at minor injuries at home and what parents need to do. So, why is it important that every parent should have some form of first aid skills? It is a fact that minor injuries will always happen at home, and it is important that the parents have some know-how on how to manage cuts, burns, bruises, and sprains, because this will be part of your daily life. Then it is important that we prevent panicking and also doing the wrong things, because sometimes what you do could make an injury that was just very minor to become a nightmare and can make it life-threatening. So knowing what to do instantly can save your child pain, fear, and even a trip to the emergency department. So what are some of the golden rules in first aid? One, as always, stay calm. Children may copy your emotions. The way you react will also depend on how your child will react. If you are panicky, if you are fussy, then your child will also become the same way, and this can make the injury worse. So ensure safety. So before you do anything, once you make the life of the child is safe, and when we are talking about making sure that the life of the child is safe, we are saying that you have made sure that the child is breathing okay, he has no danger to his circulation, and he is not losing blood. If you have a cattle that is bleeding, then you should first of all stop the bleeding so that the child does not lose blood and his life is safe. Then act fast, but also act gently. That is why it is important that you stay calm and always have a first aid kit, which is always handy. You can be able to get bandages, you can be able to get ice as soon as possible. Keep a well-stocked first aid and also keep it reachable, and always check the content of your first aid kit so that you know that what you need in an emergency situation is always handy. So, what do you do when you have cuts and scrapes? One, wash your hands, rinse the wounds with clean running water, apply pressure with a clean cloth. So when a place is bleeding, just applying the pressure, and you apply the pressure consistently, will stop the bleeding. And then you make sure that you are applying the pressure with a clean bandage. If you have some gauzes or some dressing, you can dress and then apply some crepe bandage on the area. Then use antiseptic to cover the area with a sterile bandage, and then wash for infection. Also, if you have anything for pain, you can give some common over-the-counter pain medicine like paracetamol or brufen, especially for small children. So do not use cotton wool on open wood, because it gets stuck on the wood, and this will make it worse. Do not apply unclean substances like toothpaste or herbs, because some parents will apply toothpaste, like for example, when a child has a burn. This is not recommended. It will make the scald or the burn worse and cause more problems like infection. When a child gets burns or scalds, what do? Cool the burn with cold water for about 20 minutes. Just make clean water, run over the burn and keep running it for about 20 minutes. This will help cool the skin and prevent more injuries to the skin and also to the tissues around the burn. Of course, you have to make sure that there's no more exposure to the burn. So then cover loosely with a clean cloth and then give some pain relief like paracetamol. See a doctor if large or if there is blistering. If the burns are in the hands, in the legs, in the private parts of a child, all burns are on the face and they touch around the eyes. If the burning was involved with the things like smoke or a house on fire, then you need to see a doctor because you may not know the extent of the internal injury. Like, for example, if a child was lighting the kerosene lamps and got burned and the flame covered the whole child's face, then that could mean that you need to take the child immediately to the hospital because there could be an aspect of internal injuries. So make sure that you do take the child to the hospital. Do not apply things like oil, butter, or toothpaste or ice directly because they can cause more harm to the tissues. So if you have nosebleeds, if you want a full lecture on what to do with the nosebleed, I have given a video on this in one of my previous presentation. You can check the overall YouTube channel on what to do in case of a nosebleed and the first aid. But as a matter of first aid, when you have a child with a nosebleed, sit the child upright, let the head bend forward, hold the nostrils on the soft part of the nostrils and press it consistently without leaving for about 10 minutes. Then you release. If the nosebleed is still there, then pinch again for another 15 minutes. With the child bending up, do not let the child bend backwards because he might swallow the blood, but let the forehead be facing downwards. You can apply cold compresses on the forehead to cool the blood vessels and to try to slow down the blood supply to the nostrils. If you apply this 3 times and the bleeding is not stopping, then you need to go to the emergency department for more assistance. So reassure the child because nosebleeds most of the time can cause panic and they can cause restlessness. But just be calm. Do not tilt the head backwards and do not put anything in the nostrils. Just apply pressure and that will help. If your child have sprains and strains, these sprains are whereby there is possibly an abnormal twist of a arm or a limb, and this you need to remember what we call the rise. What does this represent? R stands for rest the injured area. So just putting it with the support of possibly some firm things that you can support with. Ice wrapped around with a cloth for 15 to 20 minutes to reduce the inflammation or the swelling. Then compress with a bandage, just tying something firm, but remember not to cover the extremities completely so that you can see when they are turning blue or they are turning dark. Because when you see the extremities turning dark, you know that you have tied it too tight, that you are compressing the blood pressure to the extremity part of the limb. And then elevate, reduce swelling. Remember always that any injured part, try to put it above the heart level so that you reduce the amount of swelling. So when do you seek emergency care? If there is a heavy bleeding that does not stop, get emergency assistance. If you have deep cuts that are gaping and they are bleeding and you are not able to stop the bleeding, get to the hospital. Anybody who has a head injury and is getting confused, get to the hospital. If you have signs of broken bones, get to the hospital. If you have burns covering large areas involving the face, involving the private parts, involving the hands and the lower parts of the legs, you need to go to the hospital because this can worsen and you need a professional assistance. So how do you manage your first aid kit at home? Ensure you have sterile gauzes, you have bandages, and you have plasters. Ensure that you have some antiseptic cream. Ensure that you have some scissors for cutting. Have a digital thermometer, very important for checking the temperature. And these days they are available at affordable prices. Have some gloves. Have some pain relievers. Have a burn gel or some cold packs. And then remember that the most powerful thing you can give to a child in a crisis is a calm and prepared parent. So get informed and know what to do. So learn to stay calm, act, and stay calm. So comment first aid for a printable emergency guide for parents so that you can know what to do in times of an emergency. Thank you for watching. If you like the content of this video, please subscribe to the Overall Health YouTube channel. Also share and leave us comments below the video so that we know, is this content appropriate for you? Does it help? And what more would you want? Thank you for watching.